you ever thought about going into healthcare but don't know where to start? It's difficult but not impossible. Here we'll discuss the process of becoming a nurse and the different pathways you can take to get there. You could start with a simple diploma from a nursing program like a CNA license. There are some healthcare facilities that offer 4 to 16-week programs to get a nurse's assistant license. This would be great for someone who isn't sure if they want to go into healthcare long-term or become a nurse long-term. You could do this to get your foot in the door and gain clinical experience to make sure that this is really what you want to do. The average annual salary for a CNA is around $32,000 according to salary.com. You could also go for your ADN, which is your associate's degree in nursing. Some colleges offer this program, which can take anywhere from 2 to 4 years, depending on the facility. This option allows you to sit for the NCLEX and become a registered nurse. The average annual salary for an ADN is $75,000 according to nurse.org and the Occupational Outlook Handbook. Another option is going straight for a BSN, a Bachelor's of Science in Nursing. This route takes a little bit longer, usually about 4 to 5 years. However, this route allows more room for career advancement. With a BSN, you're able to move up the ranks and become a nurse supervisor. You can also become a nurse educator if you have a bachelor's degree. The pay rate is also significantly higher for a BSN, around $92,000 a year according to nurse.org. You also need around 600 nursing clinical hours to get licensed. This varies depending on facility, job title, and responsibilities. For a BSN, there are also some other requirements you may need to meet depending on the facility that employs you. You must pass the NCLEX exam. You will also need CPR certification, ACLS certification, which is Advanced Cardiac Life Support, and BLS certification, which is Basic Life Support, according to the Occupational Outlook Handbook. There are many key responsibilities a nurse has on a daily basis. Some of these include coordinating care plans with other healthcare providers, operating diagnostic testing equipment and performing diagnostic tests, communicating those results to providers, and coordinating discharge plans with patients and their families before they leave the hospital, just to name a few. These are all according to the Occupational Outlook Handbook. If you are a nurse supervisor, your responsibilities may include assigning nurses to patient rooms for their shifts, counting medication cards for accuracy, and creating the work schedule for your team. If you love helping and healing people and this sounds like something that speaks to you, it is definitely within reach. Just call a local college and ask to speak to an advisor, and they will help you take those first steps into your new journey as a nurse. It's never too late to do what you love.